update in relation to the COVID-19 situation unfolding in Perth. This is obviously a fast-moving situation, and the people of Perth have been wonderful to adapting to these rapid changes in the past, and we thank them for their efforts. So can I please ask everyone once again to be patient in the coming hours and days ahead. I will tell you what we know so far, what is being done to act on the situations, and how we are asking the community to respond. Dr. Robinson will shortly will provide some further information as well. I also have Assistant Commissioner Paul Steele and Director General of Health, Dr. David Russell-Weiss, to be able to answer any of your questions. Let me start by going through the timeline of events that we are particularly focused on at the moment. On Tuesday, June the 15th, a woman in her 50s travelled to Sydney for an event outside of the city. On Friday, the 18th of June, she returned back to Sydney and spent time in the Bondi area. On Saturday, the 19th of June, she had brunch in the Life Cafe in Bondi with her husband and son, who lives in Sydney. On Sunday, the 20th of June, the woman returned to Perth with her husband. At this stage, the Life Cafe was not listed as an exposure site. On Monday, the 21st of June, she and her husband returned negative test results for COVID-19. So they were allowed to return to the community. Can I emphasise that this woman did everything right? There is no question about her response, but she started developing some symptoms on Thursday, the 24th of June. On Friday, the 25th of June, she did not go to work or leave her house. On Friday, she realised that the Life Cafe had now been listed as an exposure site and arranged to get tested yesterday at Joondalup Health Campus. That result came back positive very late last night. So the period we are particularly focused on is from Tuesday the 22nd of June, when we believe she became infectious, to Thursday the 24th of June, when she was last in the community. The full list of exposure sites and time will be updated throughout the day on the Health Department website. The woman is a physiotherapist who saw some clients on Tuesday, Wednesday and Thursday. She also visited a primary school, Ocean Keys Shopping Centre in Mindarie, a gym, and the Indian Ocean Brewery in Mindarie. Dr. Robinson will shortly provide details of the current known exposure sites, which will, as I said, be updated on the Health Department website as soon as possible. So we are treating this situation very seriously. We are working on the assumption we are dealing with the very contagious Delta variant. As a result, and until public health can confirm if the virus has spread, restrictions will come into effect immediately for the Perth-Peel region for a minimum period of 3 days. The Perth-Peel region will move to Phase 1 restrictions from 12 noon today. These restrictions include mandatory mask wearing indoors, on public transport and outdoors where physical distancing is not possible. Children under 12 and those who are exempt are not required to wear masks. Public events that cannot be restricted to 150 people will be cancelled or played without spectators today, including the Chicken and Beer Festival and the AFL West Coast Eagles versus Western Bulldogs match at Optus Stadium. The match will proceed, but without spectators. A 30-person limit in all homes for private gatherings. Hospitality, entertainment venues, including casino and nightclubs, retail, beauty and hairdressers, recreation centres, including gyms, Pilates, yoga, dance and swimming pools, and places of worship can remain open, but must comply with the 2 square metre rule with a maximum of 150 patrons. Community support is permitted. Wedding and funerals can also proceed, but will be limited to a maximum of 150 attendees. Hospitals with a maximum of 4 personal visitors permitted per patient per day, mask wearing will be mandatory for staff and visitors. Anyone who enters a regional area from the Perth Peel region is required to wear a mask as per requirements in Perth Peel, and travel should be minimised. Travel to remote Aboriginal communities will be restricted. All these measures will be reviewed regularly, and the Chief Health Officer will continue to monitor the serious situation and provide more ongoing advice.